Our new
This
person, well, we
conference will
can go
now
ahead
be
and if
recorded.
you've got want to start with just kind of update on information from Columbia Memorial, and then we'll go from there. So go ahead if you've got something to share with us.
Sure. Currently, Columbia Memorial has 2 COVID-19 positive patients admitted in our hospital. We've seen a nice decline in admissions over the last week. We reopened our surgery unit for surgeries on September 20th. So we've been performing surgeries again for elective procedures since September 20th again. And that seems to be going okay. We're still seeing a fair number of respiratory cases coming to our urgent cares and primary cares. The last report I saw said somewhere in the neighborhood of 17 to 20% of our urgent care volume are respiratory types of cases. I don't know the percentage of those that are testing positive for COVID-19. And then I would say right now we have we still have National Guard here helping fill non-clinical positions. We are having a significant reduction in National Guard. Today we have 24 and tomorrow we will have 14 because they need to be transferred to other hospitals. And then on October 18th, we will be down to 12. And they're helping us with duties like housekeeping, laundry, security, screening stations, and also at Camp Rylea. And I think on vaccinations, we are preparing for the October 18th deadline for healthcare workers to be fully vaccinated or having an approved religious or medical exception. And so we're working through that process. Approximately a little over 80%, I don't have the exact number, of our CMH caregivers are fully vaccinated at this point. And we anticipate several others receiving their second shot over the next week. So we're hopeful that we won't have very many caregivers that will not have either an approved medical or religious exception or vaccination. I think that's it for me for an opening.
Okay, great, thank you. Looks like there's, I guess, a miscommunication with Jason. He's otherwise in another appointment. So Margot, if you want to go ahead.
Sure. Good morning, everyone. Good morning, Jared. Just I'll start with testing since it's been a joint operation with Columbia Memorial Hospital, although all of our efforts have been really an intense collaboration. We do have National Guard out at testing, and we're in the process of preparing for that transition as well. Testing, we're running anywhere between 30 and 50 plus tests a day out there. Many of them are what we call kind of just-in-time, same-day testing. Individuals are waking up symptomatic or finding out that they've been a contact to a positive case. So we are doing PCR testing and rapid testing out there. We have a great team of both volunteers and clinical staff who continue to operate Monday through Friday. 9 to 1 p.m. We're starting to look forward to, flu season being upon us, and perhaps testing as well for influenza out at Camp Rylea. We haven't confirmed this, but so many of the symptoms are the same, and it's very important, particularly with monoclonal treatment on the horizon, that we have, clear differential diagnosis. Nothing definitive on that, but we do have the capability to do flu testing as well. Our PIC, the Public Information Call Center, continues to operate. As we would expect, we get busy and then it gets quiet, and we're a bit busy right now because of the updates to and approvals for both the third dose, which was formerly known as the additional dose, and also the booster. So we're getting a lot of questions for that, starting to schedule some of those appointments, as well as getting some calls now about monoclonals as well. We continue to vaccinate. Our clinic's booked out 2 weeks. We have partnerships ongoing now with Medical Teams International, who will be visiting the county with 3 clinics. We are doing outreach to the Holly Farm. We're going to be doing a clinic at Clatsop Community College, and looking to stand up clinics as we formerly knew them last winter and spring, not in such a large scale as we have many providers in the community at this time. And we continue to update that availability routinely. OHA has released more testing supplies to counties, which is good news for us, which enabled us last week to now expand our testing at allowing people to test out of quarantine at 7 days if they're asymptomatic. This is important for schools as well as employers and employees. And we continue with our case investigation, contact tracing. You know, there's the cases are starting to go down, which we would see, but we're still running, actually, at least at Camp Rylea, about a 10% positivity rate out there in our cases. Of course, the vast majority are negative, which is what we want to see. And as I've mentioned previously, we are having conversations about monoclonal administration and availability in the county. And we are planning and hoping to get to that place. But like everything else, we will do it very thoughtfully and carefully to ensure that the public is safe and well cared for. That's it for me.
Okay, thanks, Margot. We'll go ahead with Eric Mengel, the Astorian. Do you have any questions for either or both of the folks here?
Yeah, do you expect to see a lot of healthcare workers asking for religious or medical exemptions?
We expect to see a fair number of the individuals that are not fully vaccinated requesting those. We have already been working on a process internally to evaluate those religious and medical exceptions and approving or denying those exceptions per the Oregon Health Authority guidelines.
Thank you.
I should also mention, I know Margot triggered my memory on this. We also are providing additional doses and booster doses at our pharmacies and our clinics if people need a booster dose of the Pfizer vaccine.
Okay, RJ, do you have a question?
Yeah, I've got a couple questions. Is the county giving Moderna second vaccines? Are they recommending that at this point? Is my first question.
I apologize. It's in our standing orders that yes, it's not a booster though, it's an additional dose for those who, or actually it's a third dose now is the language they're using, for those who are immunocompromised, but not for the general population. And again, general population is a bit qualified, and that's for the Pfizer dose.
So people that are concerned or fit into the categories, they can get the Moderna third dose. Then is what you're saying.
If they are immunocompromised, so it's that. Fortunately, it's very clearly defined. Then they can get that third dose of Moderna 28 days after they've received their second dose.
I see. Can you address how you work with the schools in terms of receiving reports of positive cases? And as I understood what you just said, a student who has a positive case is expected to quarantine for 7 days. Do they need a test to go back to school, or they just, if they're asymptomatic, they can go back to school?
No, they do need to test out. So the investigative guidelines have not changed. The recommended quarantine is 14 days. The local public health authorities have the ability to, and this was as of August 6th, to implement a 10-day quarantine. Many counties opted for the 10-day quarantine, I think for fairly obvious reasons, but there's a difference, especially when you're out of work or out of school, that 14 to 10 days. And then also there is the option to test out of quarantine at 7 days if you're an asymptomatic contact. Again, it has not changed that if you're vaccinated, which doesn't apply to kids who are under 12, you do not need to quarantine. So schools have the ability to test, but we also at Camp Rylea implemented the test out. But previously it was a supply chain issue, which is why we were not able to do it. We have adequate supplies now at this point. We want employees back at work. We want employers to have their staff back at work, and we want kids back in school. So I think it's all hands on deck. If we can test out and they meet the criteria, we'll do that to get them back to where they need to be. In terms of reporting for schools, I think I've shared this when we've had our, our news conference with the schools, is there's a few different ways we receive reports of a positive case. If it happens in the school setting, all of our districts continue to do diagnostic testing. There's 3 options for school districts. If they get a positive, they will either call the health department and report that, or they fax that information to us. And school districts also have a portal where they enter any cases they have into that portal, and it gets connected to the statewide database for COVID reports. And then we also receive it but through electronic lab reporting as well. The schools are very, very conscientious and very timely in reporting cases to us, whether it comes from the superintendent or the school nurse.
So it sounds like if now that you have supplies for testing, that if someone had symptoms, you could get them tested that day. Is that possible?
We've been able to test, if someone is symptomatic, they can get tested regardless, because, well, they should be. They can make an appointment at Camp Rylea. Most people, we have more than enough appointments now to see someone in the same day. We test them. If they test positive, they go into isolation, not quarantine. And so positive case gets isolated, a contact is quarantined.
I see. And can they get tested at the hospitals too as well, Jared?
So we are really encouraging people to use the drive-through testing site versus potentially exposing others and coming into our urgent cares and emergency departments when they have mild to moderate symptoms. Of course, if someone is starting to have moderate to severe symptoms, we want them seen. But we are currently recommending that for the worried well, the potentially exposed, the mild symptomatic, that they make an appointment with the county testing site where we can do it in a controlled way. We have some staff out there, and we limit the exposure risk to other otherwise healthy individuals in our organization.
All right, thank you.
And I would just like to piggyback on that, we worked at both Providence and Columbia Memorial Hospital and Public Health. We worked very closely together to set up a shared kind of, if you will, triage system and infographic that we could, that was user-friendly to the public to help them, one, manage their situation and symptoms, but also to deflect them away from urgent care and emergency rooms. The state continues to put out that message. The hospitals and urgent cares are there to take care of sick people, not to do routine testing of asymptomatic contacts or mildly symptomatic. When they come to get tested, they're given quite a bit of patient information. It's all updated. And then if their symptoms, if they test positive, their symptoms progress, then they can connect with their primary care home or go to be evaluated at that point in time. I also wanted to make the point, because I think since we last spoke, at Camp Rylea, we've had a designated site just for testing. We're actually relocating that site on Camp Rylea to an even better location, which will allow us to, because of the weather and wind out there, we'll have actually a drive-through. There's a port kind of over an awning over the building. And so cars will be able to drive through and get tested if they're not able to get out of the car. And the building that we'll be in will allow us to do testing in the morning and vaccinations in the afternoon, as well as drive-through vaccinations for those who are have difficulty getting out of their car. We will be able to vaccinate them in their cars. So again, I'm pleased that we're able to continue making improvements to accessibility and efficiency.
Actually, I have one more question regarding the flu that you mentioned, the flu shots. Is there a specific flu that you're looking at? Is this the same flu that we had last year, or are there new flus that, has the vaccine changed? Why should people, since things change so much, can people be confident that their flu shot is going to meet whatever comes up?
I think perhaps we can both answer this in different ways, but I'll start and tell you what I know and what I don't know. I don't know what strains are actually in this year's flu vaccine. That was determined some time ago when strains were circulating in the world, and statistically what seems to be most likely to infect us. What we can expect to see is an increase in flu cases simply because we're out and about more than we were a year ago. Again, the protective measures, many that we have in place right now, are not new. They've been in place for well over a decade during flu season. That is, stay home if you're sick, get tested, wear masks, etc. And so send kids home if they're sick, not just if they have like a little sniffle. So I would expect to see less flu circulating, although I expect to see more than we did last year. We just received our flu packet from the Oregon Health Authority yesterday. The current recommendation is that you can get a flu shot concurrently with the COVID vaccine. There's no contraindication for that. We get our flu vaccine from different sources. And we use it for different populations in the community. We just received our private stock flu vaccine, which will now allow us to begin administering flu vaccines to the general population. And we usually start doing that in October.
I see. Thank you.
Yeah, and on our end, we just started beginning to administer our flu vaccine to our healthcare workers. I am not sure of the strain either. I don't know the specifics on what the vaccine, what flu strains it's geared towards here. So,
thank you.
Any other questions? Well, if not, I don't know if Margot or Jared have any parting comments.
no, I don't have anything else this time.
Okay. Well, thanks everyone for joining us, and we will be back next week with our conference with school superintendents, and then in 2 weeks again with our hospital representatives. So thank you everyone. We'll have a recording of the news conference posted on the county website later today, hopefully. So thanks everyone.
Thank you.
Thank you very much.
Thank you.